With spinal injury, this would be where someone's actually hurt their back. Now let's just clarify exactly the difference between spinal injury and a normal back pain. With normal back pain, where you pull yourself or you hurt yourself, you may well do a strain or a sprain. These are sort of soft tissue damage. It may be slipped discs and other things like this. There's lots of different ways you can hurt your back. Within this module to start with, we're going to concentrate on spinal injury where the back is potentially actually broken. Inside the bones of your back is your spinal cord. Once this spinal cord has been cut, then it cannot be repaired. So this is where if someone's hurt themselves, it may be a car accident or fallen from a ladder, what can happen then is the spinal cord can get damaged, and then maybe this person would lose feeling or use of their body beyond that point. Now, normal back pain, although it's very, very uncomfortable and maybe you can't move, if maybe you just pick something up and hurt your back, then you need to sit, you need to rest, and you also need to contact the doctors, or in some cases also call emergency services. With spinal injury, the important thing here is we must not move the patient. If somebody had broken their back, maybe in this example we're looking at now, somebody has fallen from a ladder, they're now laying on the floor. So you approach the person. Now, if they've fallen from a ladder, you would now suspect spinal injury. Because we suspect spinal injury, we always treat it as spinal injury.
Stay still, don't move. Just stay there, Derek.
So we're suspecting spinal injury, so the first thing we're doing is telling the person, do not move. You can still introduce yourself, you can still shout for help. And you can go around and just support their head, which is holding their head in what's called the neutral position, just looking straight ahead. Tell them to look up. Try not to say anything or approach them in a way that they're going to turn their head to look at you, because this could be something that would cause damage. If you approach someone in a car accident, for example, you would approach from the front of the car and tell them to keep on looking forwards, to stop them turning their head to look at you from the side of the car. So the person here has fallen down, you've approached, you're holding onto their head to keep that nice and safe. Try not to cover their ears up, because if they're conscious, you still want to talk to them, and even if they're not conscious, again, you would talk to them.
Help, Rosemary. Yeah, I think he's hurt his back. Can you go into the house and ring for an ambulance and then come back and tell me what's happening?
I will, yes, thank you.
Send somebody to call the emergency services and tell them that you're dealing with someone who has hurt their back and you're worried about spinal injury. Then you just need to leave them there. Keep talking to them, tell them not to move. If someone else can come along to help you, then yeah, they could cover them with a blanket to keep them warm, but just try and reassure them. Tell them you're just doing this to prevent any possible harm. One thing with spinal injury is the treatment you're giving is exactly the same as the paramedics. The only way we're going to find out if this person has actually damaged their back is in a hospital. So what the paramedics will do is they'll put the person onto a stretcher and immobilize them on a stretcher and then transport them by ambulance to hospital. And then in the hospital, they'll then have the x-rays to find out exactly what has happened.
It's okay, the ambulance is on its way. They say it'll be about 10 minutes.
Okay, now can you go back out and make sure you're there so that you're able to wave the ambulance down and show them where to go?
I will.
Okay, thank you, Rosemary.
Righto.
If you can send someone for help, great. If you need to leave this person and go for help yourself, so maybe you don't have a mobile phone with you, you need to go into the house to make the phone call, then there's always a risk of leaving someone on their back that they could vomit and then choke on their vomit. So what we would do in this instance would be to put them in the recovery position. This is exactly the same as we've learned before. However, when you're putting them in the recovery position, just try and keep the spine as straight as possible. With the hand under the face, you're supporting the head to keep that spine as straight as possible as you move them onto their side. This means that when you leave the person, there's less chance of them choking on their own vomit and the situation becoming even worse.
I'm just going to go and call the emergency services.